Now it's on YouTube.
Oh wow.
Yeah, it's amazing. So I don't need to record and make videos. Hello everyone. Good afternoon. If it's good evening, if that's in your country, it's evening. This is Weifeng. I'm the microsurgery teacher in UW Medicine, and today we have our guest student, Bruce. Yeah, Bruce is from yeah.
Yeah, so
UT Austin.
I'm Hrishabh Bhosale from UT Houston.
Yeah, and today we will Bruce visit this our division for 4 weeks. So this is the third week, and we provide every visiting student opportunity to hands-on in the lab for 2 hours. Then we practice the microsurgery. The first lesson, the intro of microsurgery. Today we will go over the microscope, the instrument, and the suture, and then practice some skill handling the suture and knot tying method. Yeah, it should be fun. Yeah, and yeah, Bruce, tell us a little bit about you.
Yeah, very excited to be here. I'm Hrishabh Bhosale. I'm from Houston, Texas. Currently a fourth year med student at McGovern Medical School, and here visiting as a sub-I, and it's been a fantastic 3 weeks. I'm excited to learn more.
Yeah, and today Dean is our research fellow, and we already practiced some microsurgery. So if you help me to teach Bruce, we'll teach together. Yeah. Okay.
Do it.
You can see it over here. So a couple things, you'll have the controls under the table here. Heel controls. Yeah, so zoom is on your left and then focus is on your right. So heel in there. First part is just getting the microscope set up. So what you'll see up here at the top is your bulb starting here. These pieces right here, they turn. So you'll see a kind of a silver line and then like a plus and minus.
Silver line and plus or minus. Yeah.
So if this accommodates to your,
Oh, okay.
that accommodates to your kind of eyes. So I see that we're in glasses, so if those accommodate to kind of standard vision, then you might not need to adjust it.
So here, that's your eye. Now you already wear glasses, so put it to the neutral position.
Okay.
So put it to the neutral position. Because your eye is normal now.
Okay.
For the situation like I even wearing glasses, but my eyes not good. I have some nearsighted now, maybe farsighted, so I need to use this one to correct my eye. So for you, you need to neutral position.
So imagine if your attending has scrubbed into the case, left this neutral, and then they have adjusted their focus, but when you look at it, it's out of focus. You can adjust the eyepieces to where you need them. So if you can start off,
I would keep it in neutral.
yeah, start neutral and then kind of work over from there. So the second part of setting the microscope is this is a measure of interpupillary distance. So I'm somewhere between 68 and 69. What you want to focus on is you should see 2 round circles, and then those circles should be combined into one. So one way to kind of to start maybe a little bit back, and focus your eyes on the 2 circles, and then bring your head towards. So what number do you got over here?
60.
So is it one image there? You see kind of, the image is blurry, but.
That's one image.
And then do you know how kind of far you should get away from your lenses? So you're gonna start with your head back. You're gonna see the two dots, and then slowly bring your head forward. And then within those converge in one image, and you can see kind of the entire field of view. That's where you're, it's kind of a good way to orientate yourself. So limited zoom. Zoom us out here. So a couple things to note. So you can see on the eyepieces here. It's a 10x eyepiece. And right about here, because that's it, 0. So it's 10 times 0. So that's your magnification. So write down 4x. And I want you to use the foot pedals to focus in on the glare. So focus to where it's clear for you. So you can also you can also move the microscope up and down. So if it's not focusing, right, I can move that down. All the focus pedal does is make micro movements of the entire microscope. So is that focus for you? So what is the highest number that you can see? Like how many millimeters? So write down, so 4x, you can see 68 millimeters. Now I want you to zoom in all the way. It's probably going to be, you're going to have to use your closest to me, use the side closest to me. Slowly. So that's, so you see pressing down with my heel, and then if I wanted to zoom out, if I zoom in, it's my heel.
So this is my step.
How far are you? Just as far as it goes. Stop. Now correct focus.
And you can use the heel to step on the side close to you. It's like a seesaw.
Just press closest to you. Is that focus for you? Now, what does the number? What does this number say? So, what magnification is it?
Oh yeah, 2. It's 10.
24. So, what's the greatest length that you can see there?
It's the left side, the
So that's the center.
left 10. That's the left.
Okay. So write down 10. Now, if I hold it like this, what is the greatest thing that's the greatest length that's in focus?
Probably
So each of those is
2 millimeters.
1, 2 millimeters. So this is your. You can call it length. You can call it width, whatever you like. And then what I was doing, I was holding this. This is your depth. So these are your length numbers, and then write down whatever your depth is. So at 24, you said 2. Yeah, so let's do all the way out again. What's the greatest number you can see that's in focus?
Actually, could be like 19, 20-ish.
So write down that. So at 4x. So just take a look at those numbers. Think about it.
Yeah.
Right? When we are at the highest focus, right? We see, what was it? 68 by your depth, which was 20. So think of it like a rectangle, right? It's pretty wide, but it's not very tall. And then when we get down to 24,
It's pretty wide, but
you can only see a millimeter or two. So you're really, when you think about it, you're operating kind of in a long, but not very tall space. So everything that's in focus, that's what you can manipulate, that's what you can grab. Anything that goes above, out of focus, anything that goes out of that box, you can't see. So it's something to keep in mind that when you're making all your movements, you want to stay in that space. And that obviously scales with the magnification. So let me ask you this question. So when we were at max, like 4x, we had to refocus it. See the movement. And then we went down to 24, we had to refocus it again. But now we're back at 4, but it's in focus. So we started at 4, and we had to use the focus to adjust it. And then we zoomed in to 24x, but then it was out of focus. We had to readjust. So now we're back at 4, and we're not having to change it. I guarantee you, if we go into 10, 12, whatever, it'll be in focus. You want to explain the confocal?
Keep going.
So the confocal, Dr. Zing will fill in any details, but basically it's the way that it's called a confocal view. I don't know a lot of the details about why that makes it the special, but it's basically setting. You've drawn it once before. Kind of setting if this is a millimeter. So if we're looking at the ruler, this is our kind of our field of view, right? And then that's what's in focus. We can see this, and then when we zoom in, the separation between those becomes higher. It's kind of like a scaling principle. Right? So you set your upper scale and your lower scale. Anything between them should be. Want to add anything to that?
Other than that, it's like confocal is a terminology of a set of the microscope setup. It means, no matter you zoom into a different magnification, stay in focus. So that's the best, right? We don't need to adjust it anymore, right? But at the beginning, you see when we zoom in and then our focus, we have to refocus. So the confocal is one of the best data of the microscope you want. I think about if you do finger representation, you may do 6 to millimeter 8 for the physical art, maybe 10 on the main. So if you need to adjust again and again, it's not good. But if it can stay in focus, you just change the magnification. That's good, right? So the confocal is a practical part of how we use the depth. So the depth you can see is like 20 and 2 millimeter. It's not only 2 number. So beyond these 2 number, it suggests how we set up the microscope. By 4 times magnification. The ruler maybe in here, maybe in here, maybe in here. Right? We can see clear. Yeah. And when we zoom into 24 times, the depth becomes so small. We need to be very lucky that the ruler within the same plane, and then we can see clear. But actually, most of the time, with our focus. So when at 24 times, we will set up the microscope, the focus microscope. That means then we can see clear the ruler is within this 2 millimeter. And when we see clear, and then we zoom out, we have a bigger depth. And then the bigger depth will definitely be including small depth inside. That's why when we set up in a higher magnification, when we go to the lower magnification, we can stay in focus because the depth from smaller depth to bigger depth, larger depth. So this is confocal when we set up the microscope in the higher power. You can achieve the confocal step out of the microscope.
It's because we focus on the middle and the sides. Yes.
Yeah. So then suggest when we go to the OR, now you're supposed to change the magnification from wire range. We should set up a microscope in higher power. But for DIEP, most of the time you use 6 and 4. It's very easy. You don't have to change too much. Some of the institute you just use rule to do DIEP.
Yeah. And
Really?
I don't know.
But it's hard. You need to. I mean, at the beginning you need to get used to it. Sometimes you need to use your experience to compensate something you may not see clear and by guessing. Microscope still you can see clear, but it takes time to set up. Yeah, that's the depth. Okay.
So I can give you some. So for a 1 millimeter vessel, you can start around 10x. 2 millimeter vessel, somewhere between 6 and 8. And then if it's 0.5 or less, you can do 12 to 13x. Those are to give you some kind of ideas. And you have to remember that you want to be, when you do an anastomosis, you want to do it in the least amount of magnification needed. Because if you're doing it very, with a high degree of magnification, you have to remember your box is a lot smaller,
Mhm.
right? And it also,
So you lose space the more.
and it'll also strain more on your eyes. So if your anastomosis takes up the entire field of view, there's a lot of moving things. Whereas if it's kind of at a more appropriate like distance, you can still see what you're doing. There's less moving parts. Right. So if you don't want to zoom in as much as so it's like gigantic.
Yeah.
Same way you don't sit in front of your TV and like
Right.
Nope. So that's it. What's the magnification on?
1.
So that's 10 total. Anything we need to add to the microscope?
No, yeah, one more thing, like, here I want you to see, like, come on, stand up, you see here, see this light spot,
Yeah.
like this is strap around. So when, think about here is the light project all the way to the lens and then come up and the eyes from here. So we want our eye stay away like this distance. So this distance can allow all the lights enter our pupil. Like if I move the eye closer, yeah, the light spot become larger. Further is also like here is like all the lights focus in this spot.
So it's not up against it.
Yeah, yeah. So this is about like 1 inch or 2 centimeters, something like that.
That makes sense.
So we will move on to talk about needle drivers. So what do you notice between these needle drivers?
Some of them are curved. They're got the micro distortions in them. Just their pointed tips. Small. Yeah.
So you pointed out some good things. So first one, yes, they're curved. So some of them are curved. Actually, most of them here are curved, and then this one's straight. For the majority of things, I think people are going to use curved, just for the preference of like when you hold it this way, some ergonomic benefits, but then you can also flip it upside down, and it changes like your directionality. When you have the straight ones, obviously straight. If you flip it upside down, it doesn't enable any more functionality. It's still straight. The other thing is that some of these handles are curved, rounded, and some of them are straight or flat, we call them. Can you think of why you want a straight, flat one as opposed to like a round one?
Like a dexterity issue. If you're like hands are more wet,
Yeah,
more challenging to grip.
absolutely. One of the big things is for like deeps, you have a lot of fat under gloves, a lot of blood, a lot of the flat ones are easier because they're not going to slip out of your hand. Right? They're gonna, it's a very simple motion. Whereas if you're doing more kind of, let's say, hand reconstruction, or you need that kind of articulation to be able to roll them, reach certain areas, so this provides, like you said, a lot more dexterity. You can notice something with these is this almost looks like a pair of scissors. So you can see under the microscope. So this was a specially designed set of needle holders with the tips to hold the needle, and then you can cut. So kind of like when you're suturing, I'm sure in third year, someone holds it up and you cut their sutures. So if you don't have an assistant with microsurgery, that's why there's often two observers, is you would be the assistant or I would be the assistant, and you'd be kind of cutting the stitches as they go to improve efficiencies in terms of that. I think the most obvious thing is the colors. So if I reorganize this a little bit, these two are going to be your stainless steel options, and then these are going to be your titaniums. Titaniums are probably going to be on the more higher ends, and then they oftentimes blue them as well. This is just like a heat treatment process. can also these are called rainbows. So your rainbows are going to be your kind of your top end, very very fine, very very delicate, very easy to damage. These are probably going to be your kind of more utility, your workhorses in the OR, for like general micro cases that you're not going to get into these. So we can actually see if we look at, so the standard tip is going to be 0.3. On most micro, your standard tip is going to be 0.3 millimeters. See how that,
So that's like the thickness of the tip. Oh,
yeah, the thickness of the tip there. These ones too. These are going to be your 0.3s. These are going to be your 0.3s. Like I said, these, I think initially were finer. These are actually retired from the OR. So these are supposed to be 0.1s. Right? You can see how fine the tips are here. But now they're kind of closer to like 0.2s because we repaired this set from the OR. But initially they're 0.1s. So you can imagine, I mean you can imagine the tips being that fine, you know?
Tiny.
Very small.
So
Very, very small. Let's take a look at identifying these. Some of them have numbers on them, some of them don't. So this one is curved 14-inch or 14 millimeter. So that's just the length of that. This one has a better kind of product description. Length 15, round curved 0.1. Brown handle, yeah. This one doesn't have. Some of them are hard to see, some of them don't have. This one's hard to see, but it's Any questions about the needle holes? Needle drivers. Oh, one thing I didn't mention. Some locks. Typically, you won't see locking needle drivers in the OR. Sometimes you will. The only thing that locking ones enable you to do is you grab the suture, and then you can place it down. It's not going to be locked, and you can pick it back up. The downside behind these is that every time you have to lock them, unlock them between stitches, which once you know how to do it, it becomes an extra step that you have to do. Any questions?
You take a look how it looks. It's a latch. When we reach together and then when push behind it,
it's very fine.
Very, micro is all about finding movements. So these are going to be your scissors, your micro scissors. You can see length changes, as we talked about, flat handle, round handle. The only additional thing that we already pointed out, some of them are straight. This one's curved. This one is fine tip, as opposed to maybe this pair. So you can see how fine. You know, you think looking at it not under the microscope and then under the microscope, you can see for sure what, why it's called fine tip. You know, when you're thinking about cutting something that's this thick or that looks like this in the microscope. It's much easier to calculate this. So these are called, these ones have some good part numbers on them. So SDC, standard dissecting scissors, or standard scissor dissection.
Yeah, first one is C.
Scissor dissecting curved 18 R8, so round 8 millimeters. That's kind
18
of
is the long, the diameter. The R is the long handle, A unit the diameter. So
so.
the handle diameter is all A unit.
So what would you say this one is?
They're dissecting or scissors dissecting. Curves.
C. Yep.
15.
Radius
Radius.
or round.
And then length is 12.
So F is fine.
Fine.
Fine 12. So if I just handed you this and you were like, you could tell exactly what it is without knowing what, without seeing it.
So 15 is the
Length
length
of
of
the length of the instrument.
the entire instrument.
So if you
So
see,
that's in centimeters.
so this was 15 millimeters. But it doesn't have it, so you can see that it's straight.
So the curved scissor, right, in general practice, most of the dissecting scissor you use is also the curved scissor. So the same, so the curved scissor is dissecting scissor. And straight scissor usually, they name it as adventitious scissor. But most of the time, we still use curved scissor to cutting and trimming adventitia. But in the textbook, when you go to see a textbook, when you're talking about cutting the adventitia, they will show you like holding the adventitia, fold the adventitia away and then cut it. And in this usually you will use a straight needle or the straight scissor to cut. I think that's why they named at the beginning the straight scissor as the adventitia scissor. Most of the time, when we can hold an adventitia like this way, that's just that's something to put up from people. That means this part is not healthy. You need to cut it.
Okay. So if you can, you shouldn't be able to stretch it.
Yeah, most of the time. So when we're doing the cleaning the adventitia, we still hold it with fine use curve scissor to cut it. But they made it in there with the very beginning.
So those are scissors. Any questions about the scissors? Like they're pretty straightforward. These are dilators of forceps. So obviously their job is to kind of pick things up as well. So you can, they're called dilators because you can stick them in the aluminum of the vessel and then you can expand them a little bit. You also use the dilators when you're suturing. You can also use the forceps for suturing as well, depending on what you're doing. So kind of the same principles here. Obviously round, flat, and then materials. This one's titanium. It's gonna have the finer tip. Kind of same thing in the length 12, and then the tips are 0.05. Under these, so these are going to be your standard. So your standards are going to be like 0.3s. Same thing with everything else. These ones are about there, maybe a little bit finer. 1.2s. Have anything. It's going to be like 0.2s maybe. So these started off life as 0.05. So you can see we're going to have a scale that goes down that low, but these are now like 0.1s. So they would be on the next scale lower. So these are retired OR ones. So what is a set of these would be a couple hundred?
Regular one is 70 to 90. This is the most supervised
So some of the needle drivers, like instead of these, would be like 1500. So you can see these. This is the bent one,
Yeah.
right?
Very easy to copy.
So it's really easy to bend them, and then there's $200. It's gone. This is kind of standard. Oh, so here's an interesting one. So that's 0.3. You see the little hole there?
Yeah.
Why do you think there would be a hole there?
You want to grab the decimal house.
Yeah, so when you're grabbing your adventitia, you grab the adventitia, and actually you're not going to crush it. So there's a little area for some relief. So this is specifically designed for grabbing adventitia. So I think that's for some any questions about the concepts.
Want to start talking about
Sutures now.
It's the
Oh, so you've seen some micro.
Yeah. You've probably
You've seen the main couplers. So why do we have a vein coupler but not a coupler for arteries?
Because the base can stretch over the
You could. You can use a coupler on the arteries, but why would you not want to do it?
Similar studies to yours, I can't remember.
So you're right. So when you do the veins, you evert the edges and you put them into the coupler. The arteries have the intimal wall, so they're a little bit thicker. So yes, it's harder to do, but you have to think about it. These have a very predefined size. So if you're putting this on an artery, you can stenose the artery a little bit. Or if you're attaching, let's just say, a 1 millimeter vessel to 2 millimeter vessel, and you put a coupler on it, one side's not going to fit. Right, so there's a little bit of difference in terms of practice. Anything else that of why you don't?
yeah, shooting is the part of evil because the vessel wall is thick.
Yeah.
Stronger muscle and it's part of the evil. The second thing is like in order to easily to evil the vessel, you may tend to go to a smaller coupler size, but then that causes some frustration. One more thing we realize, notice is artery is high pressure, 120 millimeter
Mercury.
it's pretty strong pressure. It goes to the coupler. Think about in between the coupler, there's really no space. We close it. What happened to the tissue within this coupler? It was necrosis. It crashed. So this crash tissue cannot hold 120 fluid mercury pressure within there. So it's very high risk of break, rupture.
Yeah.
That's true. I mean, any flat artery can rupture. It's kind of flap will die.
Yeah.
If you use on a big vessel, the patient may die. You don't have enough time to salvage the cells.
So you can see. I mean, it's kind of nice to see them under a microscope. So you put it on. The mechanism is kind of cool, right? It brings it forward, kind of just on these rails, and then the teeth will articulate with those holes on the other side. So I'm not going to close it, but
I see what you mean, yeah.
it's kind of nice to see. So there's actually an important thing that, the size of the teeth, you have to think about, because you're coming in at an angle, if those teeth were longer, they would not be able to kind of come together. They would kind of just stick. So that's kind of like an interesting, nifty design thing that they have. But so as you evert the veins, put them on there, close it up, and then obviously take it off there. But you're going to use another set of forceps. These are for the adventitia.
So that's the hockey stick. That's for the, see there's a hole in there. So it's the hockey stick like you can push the vessel more on it and then go through that again. Go through the
And then do you when you close these, do you squeeze on them with a little bit of a forceps, just to make sure that they're closed all the way? Yeah. So that's something cool. Was this separate from? Dr. Zane, do you have the suture and the tabs? The labels?
Oh, maybe this one. Yeah, all that small things in there.
So right when you're larger sutures, variety of materials, that you can use. The majority, I think all microsutures are going to be a monofilament, typically nylon. So they come in different 9Os, 10Os, 8Os, 11. I have a 12 over here, but I don't have a label for that. So something to think about is, and to keep in mind, because this is standard across all kind of any sutures, but your suture material is actually separate from your needle. So if you ask for a 4O, that is just telling you what material, the suture material. That's not telling you anything about the needle. So you can see, right, if I just look at these, so if you're in an operating room and you ask for an 8O, and they give you this, then you ask for 9O and they give you this. Well, this is a 5.1 needle, and this is a 5mm needle. So you're like, this is the same size needle I asked for an 9O, not an 8O. Right? Where standard for a 9O would be 3.8 millimeters. Now, most hospitals or most ORs that you're going to go to, this is going to be sorted out. The OR staff will know when you say 9O, it comes with this. But if you're an independent practice, if you're kind of setting things up, it's good to keep in mind that if you just ask for 9Os, you may not get a true 9O. The same thing you can see from here. Right, the needle size basically from this 9O, 3.8 to 3.8. So basically 9O, 10O, and 11O can have the same needle size. So this tells you a little bit about your needle. Obviously, it gives you a taper. So taper basically creates an atraumatic way to get the needle through the blood vessel. So if you had any sort of cutting, reverse cutting, you use reverse cutting for skin, you may use cutting for something else, but this creates a very atraumatic. So this is your kind of standard taper needle, and then your sizes. Here's an interesting one. Tell me about what makes that one different.
Spatula needle.
Yeah. So why would you use the spatula needle?
It's gonna be a bit of a flatter needle, right? So we're gonna get through something.
So right, this is blood vessel 100, blood vessel 130, vascular 100.
this breast is not the vascular.
What is that?
Think of urology.
Oh, vas deferens?
Yeah, vasectomy.
Vasectomy. Oh my
So
god.
this is something that they use for vasectomy reversal.
That's crazy.
So if they have to do an anastomosis of the vas deferens after it's snipped or tied or whatever they do, this is how they would do that anastomosis. So the vas deferens is actually is a large, a very large or very thick ball, very muscular. Is this a double-ended needle, or is this just
I
a
think this is
single?
single, this one.
You can think about it as a very small loop and a very thick wall, so you need the.
Interesting. So you get the needle in the. Yeah.
So think about that one.
It's another spatula. CS 160. Ophthalmology.
So what are you gonna use that for?
Corneal sutures.
That's right.
I'd like to take a look.
This was the first time I've actually saw one of these.
Alright, can you zoom this in for me?
Yes.
Just wanted to take a nice.
That needle there.
Yeah,
On your left.
you think so?
Holy shit.
Zoom in a little bit more.
Yeah, whoa.
Right, so you can see the real.
So why would you want a needle like this?
For ophthalmology.
Corneas are pretty thick.
Yeah. So why would you want a needle like that has a
Spatula shape.
So you can look through that causing like a circular hole.
Almost. I mean, you want to stay. You don't want to dive deep into structure. So when it's flat, you can stay very, very superficial, and then bring it up.
right, kind of like that. I mean,
It's obviously this is not cornea, but you don't want to dive too deep into the
cornea,
yeah, because the eye obviously has
pockets of fluid and whatnot. So
it's just something interesting that you don't think about it. Obviously, being in plastics or wanting to learn plastics, that there's microsurgical applications in urology, ophthalmology. There's, I think, some same thing in like obstetrics and gynecology, ENT, obviously,
otolaryngology.
So here's a nice little. You can grab a set of forceps if you want, and then just kind of zoom us. Collection of needles here. You can kind of take a look and see kind of what their sizes, how they differ. And I think seeing them in kind of individual is interesting, but together, I don't know. I think this may be 9 maybe. Looking at how big it is compared to this might be like an 11 or 12. So you can see the diameter of the needle is different. Right? You can see the suture material is almost, it looks like it's a lot thicker. It looks quite a bit thicker on the microscope.
Yeah, this guy's just huge.
Yeah. It looks gigantic, and then you look at it not under the microscope, and you're like,
This little guy right here. Just mind blowing.
So let me change this out for this one. So if I tell you how many needles are in there,
I just see one. This is gonna be crazy, isn't it?
that one's a bent one, but
But still, it's tiny.
let me find a non-bent one so you can truly appreciate that.
Oh my god, it's so small. Whoa.
Just the tail.
Just the suture. Can I open this up? Or do you have to open box of 12? I looked at all of those. There was
What about the other lawsuit?
yeah.
It's just bent.
Just a bit.
I think that's 11.
Oh,
This one is
oh, but this is 11. Oh, it's similar.
Yeah.
And the needle is
like
50
50
micron
micron.
and 3 millimeter long. 3 millimeter. And the
Now
gauze,
some of them is
like 2 millimeter long. So think
about
about
it.
if the needle holder,
big needle holder.
it's
It's really hard.
to hold it because it will occupy the
So
lens.
that's an 11. Oh, see, bent already.
Oh my god.
That's
Oh my god.
$100.
More than 100.
These
Yeah.
are so small.
I always remember. This is like
I would use the rainbow set.
If you're gonna manipulate it.
So grab the rainbow forceps. Your right hand dominance.
Ooh. So you can play around with the one that's.
So when you think of
So these are the drivers. These are the force right?
Yeah.
so what do you know what you would use an 11-0 or 12-0 for?
Nerves?
Good. Yeah, small nerves. Uh, so anything below 10-0 is probably
Could be considered
super micro.
surgery. So super micro.
This is 48.
A little bit better for you.
So really hard to handle,
Yeah,
right?
it's like really difficult to manipulate. See, it's just like exactly like it's just
Can you grab that? You see a 12 one.
Alright.
Just
So
open
put
up
a fresh box of 12.
So very expensive.
lose it in a field,
You're never gonna find it. What do you do if that happens?
I don't know. Like, what do you do?
If you lose a 12
then that's where you go.
that's it.
You to sign document. It's your responsibility if the needle stay in the field. Because you
Unless you try to manipulate,
Just grab this one.
use the forceps here.
Oh, mess these up.
So the idea is that you try not to grab the needle with both, because the thing is so delicate that you risk bending it. So you actually, if I may, show you, you grab the suture here. You grab the suture here. You use kind of the friction that it has with the whatever you're working on. And then you can kind of make adjustments. Because if I grab this one and I move it even slightly, I'm just gonna bend the needle. Right, so you're just pushing down on it, you can see it across there.
Yeah.
So you have to be super, super, super aware.
That's crazy. Oh my god.
So what is it? 11 handful those are both.
Made by hand? Hand sharpened?
Made by who is hand sharpening these needles?
Where are they? It's the Japanese. So you're the kind of ones you'd find in the hospital are probably a couple $100 per suture. Put some stuff. Crazy though, right? You can imagine the skill needed to do that. Absolutely. So we'll get into this knot time.
and we can talk about the suture.
Oh yeah,
Vessel.
Size
We
match.
talked about the
vessel size. So an easy way to think about it is 11O is 1 millimeter.
Okay.
Sub 1 millimeter, you're talking.
You're thinking about like a 12O. You can write this down.
So 12O is going to be your 0.5. 11 is going to be your sub 1 millimeter vessel. Your 10O is your 1 to 2 millimeter vessel. Your 9 is between 2 and 3 millimeters. And then 8 is for anything greater than 3. So you can actually, the vascular surgeons will actually use 8 to do like carotid and just their loops. So even then you can do that, but a micro is like 9, 10, and definitely for 11 and 12.
So this one is by the PRHD. PRHD iron rays. So this one is more like the wrist, reading artery, ALT. This one is like in the pulmonary arch, and also proximal of the distal artery. And one is about in middle and distal flange of the distal artery. Fingertip inclination is kind of shallow. Also in the LVA, venous surface, usually vessels between 9.6 to 0.3. And anything under point 8 is considered
as concern
point 8 to point
to
3.
super microscopy.
Do I have a suture we can use through
You
time?
can open a
No.
Myo students Myo.
This is eight.
Oh, this is the AO,
Short AO, remember?
the AO I have a problem
Oh, yeah, you can.
stitching the
So now I know you want me to.
Like for the beginner, everybody think, oh, the beginner, they don't deserve to use the structure high, use the cheap one. But actually, it's not true. I mean, at the beginner, you need to use good things to teach. When you're getting better, you can handle something not good quality. Because in the not good quality needle, it's hard to clean out and keep it stabilized in not needle model. But the good thing is easier for the beginner.
So we
It's
use
the
the
best thing for you guys.
Thank you.
So I will throw this to you. Explain one more thing.
So something about micro is just staying
Kind of relax. You
on a lot of
want
tension
to
in your neck. And I just want your head to
kind of
relax, your shoulders relax. But the best ergonomics, you can get, chairs that are suited for micro and
kind of just relaxing your shoulders.
staying straight. Obviously, getting the microscope set up so your neck is
Can
not.
turn this on and off a little bit so you can just
Oh,
you
that's
can keep straight.
Dr. Zhang talks about when you couldn't see out of the microscope, so you were just using the one eye.
Put your foot on the bed or
the floor.
Yeah.
check it
So it's all about stability. So elbows on the table,
Hands.
out. The chair has problem.
Yeah.
This one
It's
cannot
not-
go too low,
good.
and this one I sitting on is cannot go too high.
so grab
Grab your needle drivers. And then grab your forceps there.
something I do kind of just
Just to when I was learning it.
kind of stabilize, find like that balance point between your DIP and then that web spacing between your first and second. Kind of this balance here. Because then the movement then is just moving your index finger. Right? And then you can make very subtle kind of rotations with your, you're just rolling. Dude, I'm just using my thumb and index finger to roll the instrument on my middle finger there. Obviously with the flats it's harder to do, but this gives you the maximum stability. Remember, you're operating in this box, so anything you move up, you're not going to see. So you're kind of thinking about your movements as more so like horizontal. So let's grab this needle. So you're going to want to hold the needle as, like that 2/3, kind of the same as regular suturing. So that 2/3 of the way up. And let's just take a bite here. So typically this will be a vessel. We can do. For practice, we can do it. So you want it to be perfect. You want your focus to be perfect. You don't want it to be a little bit off or whatnot. You want perfect focus. So you can see my needle. So I'll grab it. Here. Just somewhere that's not been used. So you're gonna kind of bring it in kind of in the 90-degree push it through. Now, if I pull like this, imagine this is a blood vessel, and my tail is caught, on something or the field or whatever, and I pull, right? I'm pulling that vessel. I'm putting tension on that vessel. That's not optimal. That can damage the vessel, especially if you just kind of pull right through it. So you want to actually control your tail. So right now my tail, I don't have control of my tail. But optimally, you want this to be as straight of a path as you can make it. But this is a very long tail because it's a brand new suture put. And I'm making one continuous pull with the suture. Right? I didn't grab the suture material. I was just holding onto the needle the entire time. If you look at this, right? Let's show you this in focus. Anytime, I'll just make an indentation here. Right? I just grab it. Everywhere I grab it, if I grab this, you see how it's flattened a little bit? Right? Every time you grab the suture, you're weakening it just a little bit at that point. So the fewest number of times that you can grab the suture, the better. Right? So that you don't have any intrinsic weakness in your suture material. Right, you can see there's some. Is it in focus for you?
Yeah.
So if I hold it like this, I don't think this gives you the best mobility, and you can't really control the tip. So this is, if you think about this, let's see, it's very too high. The bottom side of my needle driver is pointing towards, is attached, like it's coming out of the end of the stitch here. Right? I find having better control when the closest, the proximal part, or the part going to the stitch, is coming to the top of my drivers. Alright, when I do this, I can control the top, where the tip's a lot easier. You see how much easier that is? Because it's always staying in my control. So you don't have to do a surface dot on your first one, but if you have anything under tension, you can start with your surface. Now I haven't let go from here, so I'm just going to bring this back, loop it, grab my tail. Now is that going to be a square knot or not?
Yeah, you gotta turn it the other way.
Right? Exactly. I have to go like this to create a square knot. When I come back, is that a square knot or not?
Yes.
Perfect. So when microsurgery was first kind of started, the thought process was that we could take general surgery principles and apply them to microsurgery. Right? And this is exactly what you would do in general surgery, or like regular suturing. So I want you to do this. I'll cut it here, and I want you to throw a stitch with a couple knots.
Stitch. Just try whatever you can, and then Dean will share you some tips to make it easier.
Dean, how long have you been doing microsurgery?
How long have I been here?
Yeah, I was gonna say.
Actually, it's interesting that the learning curve, once someone shows you the general kind of principles, it is all about repetition after that. Right, just getting the reps in.
So what do you want me to do? Just across all of these guys?
Wherever you. So just give yourself favorable.
Over here.
Wherever you want. Yeah, it's this isn't great.
Like I'm grabbing the space.
Just follow the curvature of the needle, don't really force it. Yeah. And then you hold one continuous motion and control the tail.
So control the tail with the
If you force the tail. I'm not really pinching down on it, I'm just kind of,
letting it fall.
yeah. So, see? And you pull up on this.
Yeah. Oh,
So you want to keep it as linear as
you can. Gotcha. So could I like pull here? Would that be okay?
yeah. So every time you touch the suture, remember, you're creating a weak force. So if you grab, where's the needle? If you grab the needle and you give it one continuous long smooth hold.
So that would be its tail right there.
Next, you want to pull this.
I can see all the places I grabbed it too.
Yeah. Right. Like you, I mean, give yourself a little bit more. That's still good. It's still not too long. Alright. And grab the lead end with your needle driver. So make sure that your, so this is, when you grab it,
So like that.
so if you grab like that, so try, just try it with like that, like grab it.
That's not gonna work. So why not grab with the forceps and wrap it around the driver?
You can.
You can adjust the microscope a little bit to the center. There's a joystick on the control, on the foot control. Now the needle is not in the center of the foot.
Centered? Is that centered?
Yeah, that's it. I see the issue you're running into. It's just so hard to control.
You can take a look at
like that.
Oh.
And photo a little bit to the.
Sorry, I'm not getting it here.
I'll wait for you to be.
Sorry, I recommend using the needle driver.
Yeah, I think that's
Starts.
absolutely right. And then wrap it around the driver. Wow.
So I'll show you one more time.
Okay.
So you grab it like this. So this is the bottom of my needle driver, just pointing or is closest to the stitch. This is not going to give me control over my tail. What I'm saying is you're going to grab it like this. You can see the closest part of the suture to the stitch is coming to the top of my needle drivers. So that gives me greater control. Now, I know it's tough because it's backwards. It's backwards for you. Try that and then use your forceps to pick it up. Put the first stitch here. This one's not going to be so use your needle drivers.
So we're grabbing this guy here, right? Is that right? And then just kind of
Use your needle, so use your forceps, use your needle drivers. Here, grab just above. crossed
Because
it.
that's the.
That's where not.
Set yourself up for success here.
So clear work area. This line.
Okay. So we're grabbing this with this, right?
There you go.
So give yourself grab a little bit higher than that.
Yeah, just push the mic.
There you go.
No.
Shut this off here.
Let's try again.
New stitch.
So set yourself up for success.
So I'll hold this.
So to quickly,
I'll show you one thing. Big.
so to quickly get it loaded.
I think I showed you this earlier. Here you go. Holding this in. So I can use the kind of friction that I can create to manipulate that needle, right? Kind of make it dance a little bit, which allows me to then
Just grab it.
grab it where I want it, right?
Because if I try to use this,
I mean,
you can make small changes, but it's really hard to make those larger changes.
Gotcha.
So use your forceps to hold it.
Let's see what we can do right here. I'm just gonna.
sorry, I'll do this part. I'll do this part. Which is your, you trying to grab it that way or this way?
Towards this way.
You do it closer in there. You can just kind of readjust. Sorry, I was holding it just still.
You're good. That's pretty good.
Give it a little tension on the field.
I'll go this way. Also, can I see what you meant for? Let me try that. Follow the direction.
Because you can imagine on the smaller needles, if there's any tension on it, it's going to bend.
Yeah, I'm twerking the needle. I can feel it. Not good.
That's what I did one last time. So keep this linear. Keep linear here.
Okay.
So you want to keep this as low. You want to keep it like here and hold on.
Okay.
You had still hold on to the needle, so that was good. There you go. Smooth.
Here we are.
Set
Yourself
yourself
up for success here. So I think a little bit of a shorter tail is easier.
Okay. You're gonna grab here.
Nope, not quite.
No, grab here. No.
Remember, you have to grab with the driver.
Yeah.
So like that.
You want the
So it should be flipped, right?
Yeah, you want the.
So I guess I would have to grab with the forceps here.
you give yourself a little bit of a bend, then grab.
I was right the first time, right?
I don't think that's a knot.
Okay. Try this one. What about that?
Does it hold there? Yeah, it doesn't do that. Just
Not a knot. So
doesn't look like one.
let's try again.
So remember here, you want to grab. You grab
Like this.
hard to manipulate the tip. I'm gonna grab like that. So I'll hand that to you. So you can put that in your needle driver. There you go. So let me. Yeah, but the way I handed it to you, I think is makes it nice. Yeah, because then there you go. Now yeah, just the way that it was curled. 1, 2. Keep it close.
So I like to say, set yourself up for success. So make sure that, you know, the suture is not like wrapped around or.
Wrap here.
And then you grab it. Alright, but you need more slack on the.
Yeah, so usually the long end should be 2.5 to 3 times the short end. So we have enough slack to make certain stuff. Don't need to hurt.
This is crazy. I mean, the learning curve is like, it's not like nothing else I've ever felt so before. But it's like you can really see it. And no, that's not right, is it? Here.
You gotta grab.
Here.
Yeah, there you go.
Yeah, you're right. So it's 2 to 3 times the short end.
Yes.
Like that. And then you just go and grab it. And pop that down.
Yeah.
Wow. That's
Set yourself right here. So this has a big curve on it.
Yeah, so straighten that right out.
Yeah,
Straighten it out, straighten it out.
Straighten that.
When you're learning, it's easier to just kind of start from square one again. So, you know, you remember when you learned how to like regular suture?
Yeah.
And you put your needle driver here, and then you wrap it.
Right.
So if you start out here, it's gonna be outside. You have to start it in between your hands.
Same as regular stuff.
At least for now.
That's a great point. It's like when I'm teaching like MS1 how to suture, that's the first thing I would do. And here I am doing the exact same thing.
Alright. Now did you cross or did you not cross?
I think this is right.
I'm asking, so
Oh.
did you cross or
No,
did
I
you
did
not
not
cross?
cross.
Are you sure?
I don't know.
So, okay. That leads me into the next teaching point. Is after you finish this, I throw like 2 more. Just to get the feeling down, and then I'll show you. And then Dr. Zhang will show you how to do a little bit more fancy micro-specific.
This is awesome. I just wanted to let you know. Great job.
I appreciate it. You want me to cut it for you, or do you want to do it? I think, like I said, just
Do one more and then you can
yep. Like I said, oh, in the middle.
Oh, you're right. Could you, where'd it go? Could you do like that?
The suture a little bit longer, then you have more freedom to move.
I think it just got caught up. That's why just clearing it out. That's enough. do one at a time.
Tail management here is important too, right?
Grab this from you. Just drop it.
Yeah, tail management is, I mean, I don't think it's going to matter a whole lot if you leave it there, but
You still want to kind of keep track of it.
is it better if I do it here? Can you see that better, or?
Yeah, that one's better right there.
Middle one.
That's mostly the sentence.
I'm really not putting like a lot of force on here. I'm just, needle should do all the work. So I'm pulling it, I'm holding up the needle. I'm not grabbing the suture material. I'm just guiding it. I'm just making sure that if it's stuck on something, it's not gonna like. Right, you see all these little like points here?
Yes.
Right, all of those, imagine you're going through the blood vessel wall. So, we'll start with my normal two. Tie. Like we talked about. Typically, I would come back and I would do the second one like this. But I'm not going to do that. I'm going to transfer it to my forceps here, or my dilators. And I'm going to use my needle driver as kind of my fulcrum.
Whoa. Nice.
So this builds, this is what Dr. Zinni referenced, it builds dexterity between your hands. So I'm going to get transfer.
Swapping off.
Yep.
Wow.
So unlike regular suturing, you can't just go from your left hand to your right hand to. So this is what we want to do. So I just bring it back to my left. So here's an interesting point too. I don't think I pointed out. So tail length, you can kind of like optimize it too. So if I did this and I grab down here, right, it's gonna fold it over and get stuck. So I'm gonna do this.
I'm gonna go back.
I do my stitch and I grab the tail end, right end of it. I don't have that problem.
Yeah.
So when you're grabbing your tail,
You want to
try to grab the end of your tail as much as possible. Turn it a little bit. This is where the really small movements that your fingers come in. That's why
You have a good helper.
yeah. I'm gonna do one more. And you want to cut it for me?
Yeah.
Just made that mistake again.
You kind of want to keep these
Shorter.
a little bit shorter because the knobs are going to be so close together that the tail that you leave might interfere. Yeah, like I mean, those two knobs, you'll probably put a third one in between on the vessel. So try that with the two hand.
I'm gonna need you to walk me through it again.
Yeah.
So what we're gonna use is usually like this right here. Doing like a little wrap and then
You want to do it that way?
wrap.
Just tough this way over
Yeah,
here.
it's, yeah, I need more space on this guy. That's fine.
Keep your hand focused now.
Yeah, I can't see anything. There we go.
That's where we had to cross. So it means you had to start it with your needle drivers rather than your forceps.
Yeah. So this one I started here.
Yeah.
So now I'll swap it out and go with this guy.
Now you'll, because that wasn't square, now you're going to grab your forceps, use your forceps, and then wrap over your needle drivers. There you go. That should be square. As long as this didn't get involved in that.
I think it is involved in that. Here, let's pull this guy back out.
So that's why just managing where the suture is and
Absolutely right.
set yourself up for success.
Stuck again.
See?
Yeah, what's going on
So
here?
just grip. Give yourself a little bit more space there.
Here, this thing's trying to stay. There we go. Why is that coming with me every single time?
Because it's kind of like looped.
It's definitely around something here. There we go.
Hold on to that. Yeah. Hold on to that. I'll transfer to the other hand.
Hold on to this.
No, not your tail.
The other guy. Okay.
No. It's easier to sort that out when you're not trying to force stitch. There you go. So use your needle drivers and then wrap it over your forceps.
Alright, tell me to do is like half this. So driver, wrap, grabby grab. Yeah, let's see if we can get that.
You had to cross that one because it's the right.
There's the way.
Yeah. So the idea is that you don't have to think about if it's the right way or the wrong way. If you just started the same way every time, you're gonna know, oh, is it in my left hand? I just have to transfer to my other hand.
So like this one would be.
Then you were gonna, yeah. And then you use your needle drivers to grab it, wrap it over your. Use your forceps to grab it, wrap it over your needle drivers.
Is that the way around?
No, it's what you were doing. So the needle drivers only really work first, just the tip area.
Oh, this one's gotta go this way though.
Maybe I wasn't looking at it.
And so the next one I would wrap with my this guy.
But try the technique, but hold on to it and then transfer it so you don't have to do
immediately.
it.
Okay, so then
So this one should be needle drivers and hold the grab around your forceps. I want you to hold on to it after I tell you.
Transco? Yeah, sorry about that. So, there's your. There you go. Now use your forceps and grab this. So, let go of this.
Oh, I see what you mean here now.
And now make your jaw.
Okay, so you're not really thinking about it at all, because
Now you're gonna hold onto it with your forceps.
yes, right.
And then let go of the tail with your right hand. Grab it. Ah, there you go. So you're always controlling it. Dr. Zhang is going to show you a couple more.
I've heard about some strategies that are
Yes, the airborne technique.
airborne technique, yes.
There's a technique where you hold on to the tail at all times so you not move loose and come up across the wrist because it should be secure. Just hold on to it with your knee finger.
Look at that. So you're always getting square now.
And you don't have to think about it.
You don't have to think about it ever.
That's right. Use
It's better is like you train between both hands. Just use one hand time out.
This is if you're ever gonna opportunity to practice, this is a good one to just kind of build up the dexterity between both of your hands. I'm going to let Dr. Zhang show you the more elegant time methods.
Passing it off and just going back around.
Yeah.
Wow, it's so much faster.
Yeah. Well, he'll show you some methods that are.
That's so good.
Very good.
Yeah, let's tuck the tails here.
Absolutely. I'm gonna head out, but it's been a pleasure.
Absolutely awesome. Thank you so much.
You're gonna have to stop by the micro lab. I'll show you what we got set up there. So you have some time before you're sub high. Alright, you got the same.
Pretty fast. Very good. So when
Okay,
holding
the knee as
you think about what is the good direction of the needle, right? So
there's two things about
the
that.
needle direction.
One is
Right, we want the needle horizontal to the surface. I mean the vessel. And we don't want to hold it too early and then it burning out. And that because we
need
need
to
to
turn
turn
around
around
to
to
yes,
yes,
right?
right? Yeah, so we also don't want to force to the tip.
Just
Just every time we start to backward. Right?
so we want to hold in the right spot, that means the needle tip is kind of horizontal
To the surface.
So in that situation, you just need to, all we need to do is
Now
dive
I want
onto
to you teach you a method of stitching the vessel. Is
all we need to do is just move forward. We don't need to turn and in the regular stitching, turn like this. In microsurgery, when we turn and raise this part, we use our left hand to raise the edge, and then we press down and move forward. And the other side, we keep the needle in the air.
Then we pick up the piston and put it on the top of the needle. Then we press down and then move forward again.
So all we need to do is just move forward. Don't need to turn and tilt after. Then we take the needle out. Think about it, we still holding the needle open like this way. Before we close the needle holder, it's one arm already hit on the needle. So we need to turn the needle, hold it open, match the curve of the needle. And then we turn the needle around. And we want the needle and hold the suture. The goal is to let this part pass the vessel wall straight. Don't go this way. And also pay attention to don't let the suture stuck somewhere because started somewhere we skip only, it will tear gradually. So usually we use the needle holder to release the field and put it here to secure the vessel. And now it's short enough to do this.
needle holder holding it.
Where we make notes, see, don't make notes. If you make notes here, you travel or to catch it. But you may see the teacher is doing fast, but it's not fast. It's because they already put the needle
Oh wow.
so close to the. You bring the needle holder and the tip of the faucet right above the shoulder. See, and just make a good catch. You don't need to travel. That's why
The
teacher
they do it
so fast
and
efficient.
They're so close to the.
Yeah.
Wow.
So you see when sometimes when you're holding the needle, I use this way, right? I try to pick up something, I turn it, hold it down. It's easier to pick up something. See?
Here with the
Yeah.
okay.
So this is the passing suture, switching suture method. Eventually, we may not use this method. So if we don't pass the suture, and we don't close the instrument, what you see the teacher will do is they pull it up and down. Although it's not completely close the instrument, this up and down also can compensate some of the angle. So it's still a square enough. If you may not see the teacher, they close the instrument, they go up and down. Have to close the instrument. So these two methods of tying, where the second is training method. Most of the time, when you're getting better, you use the first method, or don't need to pass the suture, switch the up and down. And the other method is like this. Airborne method is holding this one and release, sit, flip free, and then catch it again. Okay. Oh, this is practice. But the rest of they love this method. Once they got this method, they told me
I see them all using it.
yeah, it become my own method of tying knots. So it's fun. And in very difficult situation, sometimes you see airborne, you still lose the short end. In one very difficult situation, I can walk and grab of the space, but system is not able to help you. And then if suppose the short end, you lose the short end, and then short end is biting even paper. It's hard to pick it up. So you want to control both end. In that situation, you can use this method. And you control both of the short and long end.
So this way you don't need to, you won't lose the short end.
Looks slow,
But it's
more efficient.
because you
don't need to look for the
short
You
end.
only look for the tail, it's right there.
Yeah, you don't need to look for the short end, and then you just
need
need
minimum
help
help
from
from
the
system.
system.
So I want you to practice how bring the needle holder and the faucet right on the above of the short end, so to be more efficient. Okay.
Over here?
Yeah.
Oh, we're going through. Did you do this one?
Yeah.
So that. You're saying going here, this is where. And then, did you do both at once?
It's very close to this one step.
Okay.
When this spray piston between,
Use two steps. Because
now when you try to reach to the distal end, you may hear the proximal edging on the needle.
That happens when you start when you're stitching the first and second stitch. Okay. Yeah. Bring it back to in front of you. Like back to in front of you. Yeah. Yeah. Are you in good focus now? Huh?
You do adjust a little bit.
Yeah, start by the needle holder holding the wrong end. Yeah. No, just left to right, left to right. Because you already passed the suture. Cross the suture. Okay. Yeah.
So now I would switch.
Yeah, switch.
Bring it back to in front of you and then pass.
Like
Yeah, bring it here, in front of you here. Okay.
with this one?
Yeah.
Okay, pass the suture to your left hand. Then you can turn the needle holder further down.
Oh yeah, you're right. And you're passing again.
Yeah, bring it back in front of you to pass.
Yeah.
Let me show you like why we bring it back to here to pass. Because like if the suture in here, we reach out to here and then we bring the suture back. See the suture pointing this side is hard to remove. And if we just pick up like this way, then you can see the suture is under your manipulation, making it hard. But what happens when we bring it back to in front of us and then we pick up? This suture is pointing towards here. This direction making it very easy to make works. So when we bring it back to in front of you, everything is pointed naturally in the right way to do. Okay, that's all. So here, beautiful. Yeah. Rest your hand the hypertheta on the table, like you writing holding a pen. Holding it a little bit shorter than this one. And hold a little bit shorter. Like when we writing, we think about holding you writing your name like Rouge. Think about when you're doing the survey, translate the motion and the method doing writing your name. Just like writing your name as small as you can. That motion is the microsurgery motion.
So now we go here again.
Like this is like the short end on this side, you still should. I mean, the best way is here. You don't hold up on this one. And now you feel it's
It's a lot easier, yeah.
Yeah.
Okay, then pass the suture.
So then pass it here.
Yeah.
Oh yeah.
And pass. Like this one is switch the needle. Yeah. Oh, no, hold it. You don't hold it.
Yeah, this is easy. We will hold the suture. Okay.
And then switching here.
Yeah. Yeah.
Wow.
Yeah.
Thank you, goodness.
So as a teacher, you don't need to only practice the wrong things again and again. You have to, it just, when I just get started, a lot of times to practice. So you thought it's right, but it's so hard. When you feel it's wrong, that means maybe that's the wrong way to practice. Okay, now that's 2 hours. You don't feel that's 2 hours. Yeah. What's the another? Yeah, and I talk about the needle. So this is also very important. The one you can learn. Needle information. This is suture. 50 centimeter long, 0.3 meters. AO is 0.4, 10 is 0.2, 11 is 0.1 metric. From as 100 micron, that's 90 millimeter. This is the category of the product in that 5.1 millimeter, 3/8 circumference. We don't have half circumference. This is very close to the real. This figure is very, very close to the real needle. Nice. Okay, let's wrap up.
Thank you so much.
Yeah, come to that microphone, come to that camera. Don't have. Let's see. Hi everyone. So it's we don't realize it's already 2 hours. So that means we really enjoy the microsurgery practice because we didn't feel the time. So today we go over the microscope suture instrument. There's a lot of small detail, but it's very important so you have a whole picture of everything. Uh, and and then we go through the suture method, how to tie knots, and there's multiple way to tie knots. It's good for some is good for the beginner, some is good for the real surgery, some is good for improve the efficiency of the microsurgery. And yeah, I hope this lesson is can setting Rush up for success. I think if there's a chance when you get hands on in the OR, you know how to set up the microscope. And when you're holding the needle, your teacher may say, "Oh, it's not your first time."
Yeah.
Yeah. Yeah. Oh, Rush, please share 1 or 2 points now in your mind. You feel it's helpful today
Yeah, I think
in the
it was
learning.
a great experience. I think it's just about practicing it over and over again. And here's thank you to Dean and Dr. Zhang for their instruction today,
Mm.
which is great.
Okay. Yeah. If you like our training, please